Hello everyone, this is Image 21 for the Summer Interpretation Seminar course for D3 students at the University of Minnesota School of Dentistry. These images will create the basic knowledge for intraoral radiographic interpretation exercises in the fall and spring semester. In this video, we are going to review a single periapical radiograph to understand the radiographic diagnosis of vertical root fracture. To assist us in our learning, we'll also use a small field of view CBCT scan. The images for this patient were shared with me by Dr. Syed Attar, who was a professor at the University of Minnesota School of Dentistry and now in private practice in Dallas, Texas. On this periapical radiograph, we have metallic crowns on first and second molars. Another restoration is present on the second premolar. The first molar is endodontically treated. The pedial space on the distal aspect of the distal root is slightly wide. In the apical third, the pedial space is narrow and appears within normal limits. Around the mesial root, the lamina dura is not clearly visible. We have an irregular radiolucency almost from the area of the bifurcation to the area of the apex. Similar but less pronounced finding is also seen on the mesial aspect. The trabecular bones around the roots of the first molar have slightly increased density. Some of these findings are indirect radiographic features of vertical root fracture. In a joint statement issued by the American Academy of Oral and Maxillofacial Radiology and American Academy of Endodontics, these organizations recommend that limited field of view CBCT should be considered the imaging modality of choice if clinical examination and 2D intraoral radiography are inconclusive in the detection of vertical root fracture. We have a limited field of view CBCT scan. Let's review that. This is the CBCT scan of the patient and this is the molar of clinical concern. I have created a slice along the length of the roots. This is the distal root, adequately obturated, and let me go to the mesial root. The mesial root shows a prominent vertical bony defect from the lingual alveolar crest area to the apex. There's some widening on the buccal aspect as well. As viewed on the axial sections, the bone loss is mostly on the lingual aspect. The buccal cortical plate is also partially missing. This is more wide on the lingual aspect. This reconstructed panoramic view is a 10 mm wide slice. Let me make it thin, maybe about 0.5 millimeter. So right now I'm on the buccal root. As I scroll towards the lingual, this is the lingual part of the root. And this is the vertical root fracture. And we are picking up the endodontic obturation. Let's review the features of vertical root fracture on a radiograph. A tooth with a vertical root fracture is frequently endodontically treated. You may be able to see a vertical radiolucent line inside the root along the vertical axis of the root. This finding may not be visible in all cases. If the fracture is a few weeks or a few months old, you may see a widening of the pedial space along the length of the root. The lamina dura may be lost along the root. The typical appearance of a widening of the pedial space is a J or a fishhook radiolucency. Looking at the periapical radiograph, this is the area of the J-shaped radiolucency. Thank you very much. I'll see you again on a different intraoral radiographic interpretation video.